Yesterday, the Minister for Public Expenditure and Reform said, education is one component in ensuring a thriving population, as is feeling supported in times of ill health. Now, as many members will know here, I've been consistently raising questions about the planned relocation of the Children's Hospital in Crumlin to the National Children's Hospital site, bizarrely without the transfer of the Genomics lab. That the Genomics service is a vital service for children with rare diseases, 30% of whom will never celebrate their 5th birthday. A diagnosis is vital for them if they are able to source a treatment to prolong their far too short lives. And sadly, most of the genetic tests in this country, the samples, are actually leaving the country and going to the United States, the United Kingdom, France, Spain, Germany and Finland for genomic testing. Now, I've raised here in the House a specific concern about how the genetic information being gleaned from those samples is being handled and managed. We send the genetic sample away either through Crumlin or St James's Hospital. Usually we get a result back. But the genetic data remains in those jurisdictions, which are outside GDPR and outside the proposed European health data space. We have no idea how this data is being used for secondary purposes, and the only way to overcome this is to establish a centralised lab for genetic testing here in Ireland, and I do know that there is private capacity available here in Ireland to ensure that those tests are at least carried out here. And we have an opportunity to bring all of those samples back onto the island of Ireland and control the management of those samples here. Now, sadly, on a couple of occasions I've highlighted this issue, and I've pointed out, and I've quote from what I said here in the House, have we learned nothing from the cervical screening scandal? And unfortunately, I'm now going to bring to the attention of the House here one such example in relation to it. Now, genetic tests are complex. They require specialised staff to determine the appropriate test selection depending on the particular circumstances. Here in the Republic of Ireland, there are numerous individual dispatch laboratories right across the country. Different labs in different hospitals send their tests abroad to commercially accredited laboratories in different parts of the world without any appropriate genetic training as to determine the specialised location or what specific tests should be carried out. The dispatch from these multiple laboratories creates an increased clinical risk. A risk assessment was submitted to the HSE in 2010, identifying risks, but no action has been taken. Specialised services are centralised in the north of Ireland with appropriate controls to optimise patient safety, but sadly that doesn't happen here. What's the impact of this? Well, I'm going to give you a case of a family who suffered numerous antenatal losses. Their second pregnancy, a boy, died in 2020 and had a 22q11 genetic deletion identified after his passing by a particular laboratory. The parents' samples were sent to a different laboratory, and the test showed normal parental results, and the family were reassured that this wasn't a hereditary condition, it was just one of those things that happened. The couple had a recurrence in 2023 of their 9th pregnancy, and subsequently testing revealed that the same genetic deletion was in one of the parents that had been missed in the first set of tests, and the young man that was born at the time was confirmed as having the 22q deletion syndrome. One of the parents spoke to me and they said, on a personal level, our family has experienced profound loss, 9 pregnancies with only 1 surviving child. We know a central lab would have made a difference in our situation. Our son Oisin was born in June 2023. He had medical complexities, similar to those of our son Ross Jr., who was born with the 2022 Q11 deletion and passed away due to complications secondary to that deletion. Despite reassurances from medical professionals throughout the pregnancy, our fear of planning another funeral was very, very real. So many avoidable losses in this family stemmed from a missed diagnosis. Work missed, relationships breaking down, physical decline, weakening mental health, emotional turmoil, social isolation, and spiritual disconnect. Consequences of not having the support of a central genomics lab here in this country as they have north of the border. Minister, it's impossible to summarise the devastation suffered by this family. The consequences to the relatives now who now have to go and have an analysis carried out. How can they trust the results that they're going to get back when they're sent, those samples are sent all over the world from different hospitals without any quality control standards whatsoever? Errors in genetic testing can take years to be recognised, as is the case in this situation, requiring specialist knowledge due to the significant number of different stakeholders that are involved, leading to mistakes. The current system within the HSE poses a significant clinical risk as diagnostic stewardship is lacking centrally. Multiple hospitals are dispatching samples to multiple different foreign laboratories, some of them without the standards that we should and would have here in Ireland. The audit trail is poor and familial sample tracing is limited. So we don't even send the samples from the child along with the samples from the parents to the same laboratory. They can be on different continents where they're being tested at the moment, and sadly in this case with tragic and unfortunate outcome for this family, but many, many more families around the country. We need a centralised genetic testing laboratory, and that is urgently required here in Ireland to deal with discrepancies and anomalies as the one that I have just outlined here. And it is not good enough that families are seeing their children's samples and their samples sent to different continents, sent to different laboratories, and that every lab in this country is sending them without any standard protocol whatsoever out of this jurisdiction, when we could actually have them all processed in a single laboratory here in Ireland, hopefully in the medium term under the control of the state, but in the short term there is a private lab that could carry that out, and I would urge the government to deal with this as an issue of the utmost priority.